e-health, and can we consider health as a platform, actually, for easier transitioning care from hospital to the home? Actually, Laurent VANDEBROUCK, Managing Director Europe for Qualcomm Life, is about to join us on stage. Is actually joining us on stage right now. And we are about to see with you, Laurent, how we can, anticipate this kind of changing models when it comes to e-health.
Yeah, so I'm from Qualcomm Life. Qualcomm Life is a subsidiary fully owned by Qualcomm. We are pretty known for the chipset, for the design of chipset business, much less known for our service business. However, the first business that has been launched by Qualcomm 30 years ago was a service business, was an end-to-end service for enterprise market in the fleet management area. And we have done that for many different vertical markets, including finance, including also healthcare, and all the business around healthcare has been integrated and included in one subsidiary of Qualcomm named Qualcomm Life. So before explaining what we do in this space, what we do in the Internet of Medical Things, as we call it now, I will maybe go through some of the challenge our customers, the healthcare stakeholders, and the healthcare market go through. The first challenge I will cover is the challenge experienced by the hospitals. Hospitals is one category of our customers. The challenge they experience is that the aging population increase, and consequently, the number of patients with chronic disease also increase. There are today more than 300 million patients and people in North America and in Europe that have at least one chronic disease. When I call chronic disease, is either COPD, heart failure, diabetes, and so on. In parallel, on top of that, the budget and the number of beds available in the hospitals have more the tendency to decrease than increase in both regions, both in North America and in Europe. So it really pushed today the hospitals to try to find solutions to reduce the number of readmissions in the hospital. And one way to do that is to make sure that they can wirelessly collect the information when the patient is at home, collect all the medical data and biometrics data to remotely monitor the behavior of the patients. Another category of our customers and healthcare stakeholders are the big pharma, the pharmacy companies, the big pharma, Novartis, Roche, and others. These guys have a different challenge. They are more and more challenged and requested by the healthcare authorities to give the proof that the patient followed very well his treatment and to deliver the proof of the outcome of the treatment and the use of a drug. But in parallel, the regulatory environment for the use and collection of such biometrics data and medical data associated to the patient file and patient ID is more and more strict, both in North America and in Europe. So that really requires these guys to find solutions to securely collect the medical data, the biometrics data, to give the proof to the healthcare authority that the treatment has well been managed and delivered. That's what we do at Qualcomm Life. At Qualcomm Life, you have on this slide a small white box that, in fact, we deliver to our customers for the remote monitoring of patients with chronic disease from homes on behalf of the hospitals. That's the main application in use today. You plug this small box, this small hub and gateway in the wall of the patient, and through Wi-Fi, Bluetooth low energy, ANT+, it will synchronize with the medical devices around it, whatever the medical device. We have today 55 medical devices as part of our open ecosystem and infrastructure. The hub will encrypt the data, and transmit it through the wireless network on our cloud, on our service platform located in the Netherlands for our European operations. And we provide API access to our customers so that they can securely extract this data on our cloud and integrate it in their suite of applications and services for the GPs, for the hospitals, and also, of course, for the patients. So that's the way we deliver the information today through this physical version of the hub that we have available. More recently, we have launched and made available what we call 2Net Mobile, which is in fact an application and an SDK, an application that you download on a tablet or on a smartphone, and that will transform the smartphone and the tablet into a medical data gateway. So you can already see the use case associated to each category of hubs, the physical version of the hub, more adapted for the remote monitoring of patients with chronic disease from homes for the hospitals, and the virtual hub, which is today more used by the big pharma, the Novartis, the Roche, and others, for adherence programs in order to collect wirelessly all the data to give the proof that the patient has adhered to his treatment and to the use of the drug. So if we try to summarize what we try to achieve and what the Internet of Medical Things try to achieve is really to provide a maximum flexibility and scalability to our customers for the configuration of the kit and the modification of the kit and the medical device as part of the kit in case of patients have a new disease or as a different disease, which require to modify one medical device by another. These slides can be a little bit complex, but in fact, it's not. It's just to explain, because I would like to come back on Ambroise when you mentioned the service.
Yes.
Yeah, we need to monetize this business. So when you see this slide, you say, wow, gosh, it's a usine à gaz, as we say in French. In fact, it's not. It's just to explain rapidly how we deal with our customers and how we operate this Internet of Medical Things for the healthcare stakeholders. We do, try to come back. We do two things. We sign deals with the medical device manufacturers, whatever the AND, the Foracare, the Nonin, the Omron, in order to guarantee to our customers that on the long term, we will always be in a position to read the data, the medical data generated by the different medical devices. That's really something which is very important, because you know that these guys, they change the firmware, they change the Bluetooth interface very often, and we need to be pre-informed that they will do this change so that we can guarantee to our customers that at any time we will be in a position to read the data. And with our customers, we sign service agreements. We operate as a carrier. We operate as a service operator. We just charge a monthly fee, which includes everything. Each time that a customer plugs the hub in the wall in the home of the patient, or activate the virtual hub to Net Mobile on its smartphone or on a tablet. We operate the service, but we do not distribute the hardware. For the hardware, for the hubs, have the gateway installed in the home of the patients, and for all the medical devices, we have signed distribution agreements and deals with distributors, with logistics players, such as Ingram Europe, for instance. These guys, they receive the order from our customers for 200, 300, 500 hubs and kits, combining 5, 4, 6, 7 different medical devices. They do the pre-configuration and test, and they send it directly to the patient ready for use. We consider that if we want this market for telehealth, or for e-health, or for m-health, call it as you want, needs to grow and want to grow, it's very important to give very simple business model, and on top of that, make sure that all the logistics activities are managed by a third party so that these guys, our customers, which are telehealth service providers, system integrators, medtech, insurance payers, can really focus on the services to patients, which is their business, which is the thing which is important for them, and outsource all these activities around infrastructure management, wireless communication, mean operation and maintenance, logistics, to a third party. 2 minutes, 3 minutes?
2 minutes left.
Okay. So who is using these services of Internet of Medical Things today? We have three categories of customers. The customers, mainly the hospitals and their system integrators or telehealth service providers, which are using this Internet of Medical Things mainly for RPM, for what we call remote patient monitoring solutions, to avoid readmissions in the hospital. I give here the example of one hospital in France, because we are in France. I give the example of CHU Limoges, that today remotely monitor patients with multiple chronic disease from homes to avoid readmissions. The second category of customers, as I was saying, the big pharma that are using our infrastructure, our wireless communication means, and our cloud in order to collect the medical data and biometrics data of patients for adherence program. And the third example of customers is pharmacy chain of pharmacies. And as an example, I put here Walgreens. Walgreens has today more than 500,000 medical devices powered by TUNET for all these coaching services that they have available mainly in the US today on smartphone, on tablet, but connected to multiple sensors and medical devices that are powered by TUNET. If I only 2 minutes, I will skip this one.
Sure.
And I will try to go directly to the conclusion. These customers that I have shown before have really asked us to extend our ecosystem from outside the hospital to inside the hospitals. As you can imagine, it makes a lot of sense for an hospital, for instance, that needs to take care of a patient inside the hospitals. What he wants to make sure is that when the patient leaves the hospital, he will be in a position to continue with the same format of data, with the same protocol, to be in a position to continue to remotely monitor this patient. So that's why recently we have made one acquisition in the name of Capsule Technology in France. Capsule is doing inside the hospitals what I have just explained for outside the hospital. And the objective of that is to deliver an end-to-end services, continuity of services, and continuity of care for our different categories of customers in order to deliver and collect and visualize the medical data, whatever the patient is inside the hospitals or outside the hospitals. And I think by this kind of business model, we really enter these days on this market of the Internet of Medical Things. Thank you.
Thank you so much, Laurent. Ambroise, quick question for Laurent before we jump to smart home industry.
Okay, so thank you very much, Laurent. So actually, I want to talk a little bit about the box you have, the TUNET box. Do you see evolution where this could be kind of a portable or wearable device on the patient itself and not just synchronizing at home? And then, of course, it will use some cellular connectivity. I see some of these projects, but what do you see from your perspective?
Yeah, as you know, so Qualcomm is an expert in wireless communication, and so we have a lot of discussions and already some deals that will be soon announced, of medtech, so medical device manufacturers that have developed new generation of sensors for healthcare, and in which we have embedded this TUNET technology. So definitely that's the way we go, but it really depends on the use case and business model. But for the pharma, for instance, and what we call the medtech, the medical device manufacturers, definitely that's the trend and that's the way we go. Yeah. Okay.
And do you see resistance in terms of regulatory or patients being nervous to have a cellular device?
Well, I needed to go fast, but I think what I need to say is that we are an enabler. So Qualcomm acts as an enabler, and we have no visibility on the patient ID and the patient file. Our customer do. So when an hospital is using an infrastructure and wireless communication, that's the hospital that do the reconciliation between the medical data and the patient ID and patient file, not Qualcomm. So in terms of data confidentiality, data security, that's something completely controlled by the hospital in line with the local regulation.
Okay. Thank you very much.
Thank you so much again. Your release from duty.